So what are the signs and symptoms when a person has a clot in the leg? And this is called a deep vein thrombosis. So the clot may cause pain, redness, it's tender to the touch, and we often will call it thrombophlebitis. Now, breaking that word down, that word thrombophlebitis means clot, vein, and inflammation. This may feel like a lump when you feel it, or a cord. You can feel like a long cord within the leg. The leg can become swollen, and it can be very minimally swollen to the point where it just feels tight, or it can be quite swollen indeed. It hurts to walk, and it hurts the person to flex the ankle. But again, not always. These symptoms can be extremely variable from person to person. Now, when the clot travels through the blood vessels of the lungs, it's called a pulmonary embolism, or PE. If it's a large clot, it can block the circulation and stop oxygenation completely. Well, obviously, this is a disaster, and it can be instantly lethal. If the clot is smaller, though, or if there are many little clots, the symptoms can include anxiety, panic, a rapid heart rate, shortness of breath, low oxygen levels. There can be pain at the top of the breath, and this is called pleuritic pain. People may cough up blood. This is called hemoptysis. There can be dizziness and faintness. There can be loss of consciousness, and at its worst, of course, a person can die from this. Now, what increases the risk for a DVT or a PE? Any circumstance that leads to a person being immobile can lead to the stasis or pooling of blood in the veins, and that can lead to a clot formation. So situations where you might see this, for example, would be long flights. And you hear about this. In fact, now airlines are encouraging people to move their legs and wiggle their toes and that sort of thing to keep the blood flowing. People who are bedridden or in wheelchairs for a long period of time or forever may be at greater risk for developing venous stasis. The post-operative period and the intraoperative period may have specific opportunities for blood clots to form. And so this is why it's very, very important for people to observe self-care when recovering from a surgery. And then the next item, of course, is smoking. Well, nobody should be smoking, but especially if you are taking estrogen in any form, which possibly can increase the risk of clots. Don't smoke. Other risk factors include things that are called thrombophilias or hypercoagulable states. Now, you may have heard of some of these. These can be inherited. They can run in families. You may have heard of Factor V Leiden, for example. There's something called protein S deficiency or protein C deficiency. There's the antiphospholipid antibody syndrome, anticardiolipin, and all kinds of different things like this. Now, a clue of whether or not a person may have these can be whether or not it runs in the family. So oftentimes when I'm interviewing somebody, I want to know, do you have a history of blood clots in your family? And were they evaluated for the presence of a thrombophilia such as Factor V Leiden? And then we know that estrogen, but particularly ethinyl estradiol, can increase the risk of blood clots. Now, ethinyl estradiol is the form of estrogen that's in birth control pills. And this is very important. First of all, it's important to know that because we don't want people taking birth control pills for their HRT, okay? And I've seen people do this where they've wanted to get estrogen, they have been concerned about getting it from a medical facility, and so they've taken somebody else's birth control pills, which of course has its own problems. But remember, this may increase a person's risk of blood clots. Okay, here's my quick advice for people who are on estrogen of any form. Be aware of what DVTs and PEs are. Secondly, don't smoke. Thirdly, know the signs and symptoms of blood clots, so you might be suspicious if you had some of those symptoms occur in your body. Know if you personally carry special risks, such as a personal risk of or personal presence of thrombophilias or a hypercoagulable state. So if you've had a blood clot before, for example, and you've been diagnosed as having a hypercoagulable state, this is very important information for you to know. Know also if there's a family history of blood clots and what can you find out about the cause of those blood clots. And then take precautions when you are on long flights. What I recommend that people do is to use compression stockings, get up and walk, drink water. That's helpful because you get up and walk, you go to the bathroom and pee. So it's important for you to keep moving around. Okay, now Finally, if you have developed a blood clot, can you still take estradiol? Well, yes, you can, and often this would be on blood thinners, which are also called anticoagulants. But if this applies to you, talk to a hematologist or blood specialist to do this safely. I hope this information was helpful to you. I know it was a bit of complicated information, but if it was helpful to you, please like this video and subscribe to my channel. Thank you for watching, and I'll see you in the next video.